Hello there! Welcome to my show, COVID-19 Update by Heerak for October 26, 2020. Today is National Mule Day. As you know, we think of mules as work horses. You're listening to English folk music. As you know, England gave us Industrial Revolution. And Industrial Revolution is when workers work in factories, revolutionize the way we do work. Um, Labor unions were born. And economy improved. But unfortunately, now we have COVID-19, so economies are shrinking. It's a problem, right? Um, I have some photos from formal halls or themed halls at Cambridge University. As you know, I'm a member of Jesus College, Cambridge. Um, and you see the coat of arms or the emblem right there with three chicken. Yeah, inside a red border. Yeah, that's the coat of arms for Jesus College, Cambridge. But these formal halls are actually formal halls mostly outside of Jesus College. The one with me sitting next to a woman with a Mexican hat, that's in Jesus College. We had a Mexican formal. Um, I couldn't find the Mexican hat, but she did. So she let me wear it for a while. Um, yeah, and next to that is a formal hall at New Hall. So yeah, nice lady from New Hall College right there, redhead. She was an I guess she is an ROTC program. So she's a I guess officer in the Royal Army in Britain. Um, Next to that, yeah. So yeah, a lot of tears, a lot of dry eyes right now because of because of what's going on. A lot of people are watching their family members die of COVID-19. And people are wearing their masks and um, goggles. I see at shopping centers, people wearing goggles. So a lot of people are feeling dry eyes. So I guess, Vizine and eye drops, they're seeing a spike in sales as people feel like they need it more. And people are staying inside more too, right? So air is more dry inside because of COVID-19. Obviously, the way you survive COVID-19 is by staying inside in your own home and not socializing with other people or going inside in another person's home, right? Right now, COVID-19 is spreading like wildfire in America. Um, Yesterday and day before yesterday, we had the highest number of COVID-19 cases, over 60,000. And obviously, more cases equals more death, right? More cases, more death, more cases, more death, more cases, more death. So as you know, if you have 60,000 COVID-19 cases, let's say you have 60,000 COVID-19 cases today and your death rate is 10%, then 6,000 are going to die in one day, right? That's what it means. If you have a death rate that's 5%, then 3,000 are going to die in one day. So if you have 60,000 cases today in 24 hours, uh, in one day, you can expect 3,000 to die at the rate of 5% death rate. As you can see, we have a 3% death rate right now, but that's going to change. In the wintertime, death rate is going to increase. And I think New York went as high as 10% death rate in April. So let's say you have 10% death rate. If you're having 60,000 cases, you can expect 6,000 deaths from that day's tally of new COVID cases. So in 2 days, we had 120,000 cases. So in 2 days, you can expect 12,000 deaths, at the 10% death rate. Dr. Fauci is saying we're going to go above 100,000 cases, infections per day. So if you have 100,000 infections in one day, 24 hours at 10% death rate, 10,000 will die. If you have 200,000 infections and the death rate is 10%, 20,000 will die in one day. So you can see why, I am Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th district. And you can see why I am saying that we're going to have minimum 3 million deaths and more like 30 million deaths by June 2021. All you need is 60,000 people to die in every state to have 50 states total, or United States to have 3 million deaths. You're going to easily have 60,000 deaths in every state by June. We're talking about how many months? October, November, December, January, February, March, April, May, June. You're talking about 9 months. Yeah, we're easily going to have 3 million deaths. And I'm predicting more like 30 million deaths we're going to have by June. And we're headed there because, as you know, more cases, more death, more cases, more death, more cases, more death, more cases, more death. Yeah, so more cases you have, more death you're going to have. It's just unavoidable. It's simple math. And this is a global pandemic. We're not living in a Disneyland, everything is hunky-dory world, in the fairy tales like in Shrek world. No, we're not living in that kind of world. We're living in a dog eat dog, virus eat human, COVID-19 global pandemic era. There's no self-respecting scientist who expects death rate less than 100,000 in from COVID-19. Everybody expecting at least 100 million deaths from COVID-19. I'm saying that we're going to have 100 million deaths by June 2021. Yeah, I'm saying that we can have up to 2 billion people die from COVID in the next few decades. As you know, this is a 365 days a year. It's never going to go away as long as COVID-19 has a human host to spread in. So yeah, it could be decades of COVID-19 killing us. Every flu season, we could have like 3 to 30 million die in America. Yeah, that's what we're looking at right now. So it's not a bad thing to think back about all the fun you had before, because that era is basically gone. You know what I'm saying? Yeah, so you see a photo of me there with an Irish lassie. She's an Irish girl who studies in Cambridge, from Republic of Ireland. And then under the Jesus College coat of arms, I belong to a German society at Cambridge University. These Germans get together, and people who want to meet Germans, I like joining societies, language-based societies. Yeah, so I went to the German formal hall. It was fun. And next to that is, underneath my video, is a formal hall at Churchill College. That was a lot of fun, hanging out with the pretty girls from Churchill. Yeah. But yeah, there may be some fluke in the system in Johns Hopkins, or people are really lazy about reporting because it's Halloween season and people are going to Halloween parties. Who knows? But yeah, it's not like we had 36 deaths in 24 hours. We have 36 deaths in state of Virginia alone in 24 hours. And we're headed to danger zone, but there are other states with far more, like over 100 deaths, So yeah, seems to be some kind of fluke in the system. Sometimes the systems have downtimes. If you work at if you work, like sometimes you get an email or text message saying, oh, the system would be down from, such and such time to such and such a time, yeah, you know that. So maybe they're downtime, who knows? So at least, right now, officially, according to Johns Hopkins, School of Medicine Coronavirus Resource Center. The total cases is at 8,638,127, and the deaths are at it's it's you add 36, right? So it's 225,000 247. Some people are funny, aren't they? Yeah, so there's a comma there. Obviously, there should be three numbers after that. They wanted you to do your own math, and add to the 211. But anyway, yeah. Putting all jokes aside, sometimes systems have downtime and sometimes there are errors in systems, and we call that system errors or systemic problem if the errors keep continuing at a systems level. Yeah, when I was at the Cambridge University School of Nursing program, we had a course on looking at the systems problem in healthcare facilities like hospitals, long-term health care rehabilitation centers, that was kind of an interesting exercise, how systems level errors can happen. And we looked at the hierarchical structure of a hospital, from the top executives like chief nursing officer, chief medical officer, CEO is above them, chief executive officer. And you have different hierarchical structures that go all the way down to the local units, and sometimes there are systemic problems that cause not only many lives but also millions of dollars, in lost revenue, and sometimes it destroys efficiency. So we studied systems and how systems can have an error, and sometimes there can be systemic problems that can cause hospitals to struggle or collapse even, and generally systems level problems are blamed blame is generally placed on like executives, high level managers, like CNO or CMO. CNO is chief nursing officer. CMO is chief medical officer, because they set the policies that everybody has to follow. So if they don't set the policies that they need to set in a certain circumstance, then system-wide there will be inefficiency because there is no policy or the policy wasn't set correctly. And so generally that's why we call systems level problem. It's problems caused by executives not making the decisions that are needed during a certain circumstance, like COVID-19 global pandemic. From what I understand, our chief nursing officer and chief medical officer are very good at Virginia Hospital Center. I talked to the chief nursing officer at Georgetown MedStar Hospital. She seems really good, but not all chief nursing officers, chief medical officers will know everything that goes on because there's so many things that go on, and that's why they rely on good people to inform them with necessary information that they need to make the system efficient, because especially in an emergency like COVID-19, you need an efficient system. So this thing is really good, Canada Dry. I highly recommend it. I drink the dyed one. Yeah, it tastes good. It's like cranberry based. Yeah, so cleans out your system. Yeah. Yeah, so top 5 COVID-19 cases in the Middle East. Middle East is remarkably doing well as a continent, unlike Latin America, which is like doing really bad as a continent. We're calling Latin America COVID-19 death continent. But we can't speak too soon because it's not like America is doing well, right? United States is number 1 for COVID-19 cases and deaths. So, obviously we're not doing very well. Europe, it's spiking again. So Yeah, it's not doing very well. Probably millions will die in Europe, millions will die in America, millions will die in Latin America. That's like, I think most people are expecting that, like experts. Um, but Middle East is different. They're doing pretty good. Iran is number one. They have 574,856 cases and a 6% death rate. 32,953 have died so far. Iraq is 455,398 cases and at 10,671 total death. The death rate is at 2%. Saudi Arabia has 345,232 two cases, not death, cases. And the deaths are at 2% death rate, total death of 5,313. So that's far below many of the states in America. Still, Saudi Arabia needs to worry because it could spike up. Israel, is the first nation in the world to shut down completely before Rosh Hashanah began, holiday of Rosh Hashanah. And they were able to keep the cases and death down, but it's still growing. Obviously, even if you completely shut the country down, you're going to have new cases and new deaths. That's just expected. Italy completely shut down in March and April, and it still had 10% death rate of all who got cases, and people were getting infected even during the shutdown. Same with Spain, same with England. So even if your country goes to total shutdown, you can expect a lot of death, but obviously far fewer than if you don't shut down. Israel has 310,254 cases at 0.8 death rate. You have 2,404 deaths. Qatar has 131,432 cases, which out of which we have 230 deaths, so 0.2% death rate. So it is possible to have a low death rate out of the cases, as we see in Israel and Qatar, which are below 1%. Saudi Arabia used to be below 1%. So, I mean, it is possible, but not likely, and Israel, is able to maintain below 1% death rate, which is kind of impressive. Same with Qatar, but we're beginning 6 months of flu season, so we're not sure what's going to happen in the next 6 months. Yeah, things are going to be bad for the next 6 months. So today's title is COVID-19 the world. Will COVID-19 kill millions of Europeans in the next 6 months? That's the question we're asking. The first article says Italy closes gyms, shuts eateries early to fight COVID-19. And this article is an ABC News. Francis D'Amelio, sounds like Italian. And the significant quote from the article is Italy's leader imposed at least a month of new restrictions across the country Sunday that's yesterday, to fight rising coronavirus infections, shutting down gyms, pools, and movie theaters, putting an early curfew. So there's a curfew there. On cafes and restaurants, and mandating that people keep wearing masks outdoors. It seems like a lot of areas are opting for a transitional shutdown, which is like a curfew, right? I think that's a mistake. I think they should just shut down, because if you're having cases that are exponentially growing, that's when you should shut down. Transitional curfew would not, it will decrease the infection, but not enough to avert millions of deaths. You know what I'm saying? We have 6 more months to go. So it's better to shut down and flatten the curve. So you hear nobody talking about flatten the curve, because they just gave up on flatten the curve. They think it's impossible to flatten the curve. That's why nobody's talking about it. They've given up. So we're at next stage of COVID-19, death. They're expecting deaths. Like early in March and April, they were trying to reduce death to zero. Now they have given up on that. They expect like that, thousands of deaths. They're they're just hoping it won't be millions of deaths. You see, that's where we are right now. Because governments have seen that it's impossible to reduce death to zero, even if they completely shut down. Obviously, I think they should still completely shut down to not go to millions of deaths. But governments are always very slow. They set policies after things happen rather than like policies before things happen. You know what I mean? So they'll see millions of people dying, and then they'll set policies based on that. But it'll be too late. After a certain point of infections and death, there's no turning back. You're gonna have millions of deaths. So some say that maybe hit in like November or December, January. Nobody really knows. Everybody's just guessing right now. Yeah, because this thing is very new. It's acting in erratic ways. So one thing people know is that a lot of people are going to die. So people just disagree on the exact figure. But yeah. To continue with the article, worried about crippling Italy's stagnant economy, especially after 10 weeks of severe lockdown earlier in the pandemic, Italian Premier Giuseppe Conte opted against another heavy nationwide lockdown, which is a mistake because, I mean, it's related. If your citizens keep dying in large numbers, your economy can never get back to the level that it was, right? Because you need people to live, right? It's hard to retrain people in specialty areas, whether it's a machine operation in factories or, as an RN nurse, it takes minimum like what, 2 years to 4 years to train a person as an RN nurse. And the person has to pass the NCLEX RN exam to become an RN nurse. So, I mean, if you have RN nurses dying off, you can't produce them quickly enough, because you need like 2 to 4 years. The fastest you could produce them is, some places say they could produce them in 1 year, but they still have to take a NCLEX RN exam. And so, yeah, I mean, you can't produce specialty people in a short period of time. That's just impossible. And that's why it's a serious problem now, because a lot of nurses are expected to die. And I'm Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. And I'm predicting that we're going to have 10,000 nurses at least die by Christmas 2020, just in the United States of America. So I'm predicting that minimum 12 nurses will die in every hospital in this area. Inova Fairfax Hospital, Inova Alexandria Hospital, Virginia Hospital Center, MedStar Georgetown University Hospital, MedStar Washington Hospital Center, Children's National Hospital, George Washington Hospital, Sibley Hospital, Suburban Hospital. You name the hospital, you can expect minimum 12 nurses to die. They're irreplaceable. You can't replace them because it's not just one hospital that has 12 nurses die. It's like every hospital will have 12 nurses die. Every hospital is desperate for nurses. You're not going to be able to replace them. How are you going to find nurses to replace them? Because this is not just a pandemic that's happening in New Jersey or New York or Virginia, right? It's happening in all 50 states. In all 50 states, all the hospitals are headed toward becoming completely full. They're all desperate for nurses. Even now, as we speak, there are nurse shortages in hospitals in many states. So you're looking at a situation where every hospital will have shortage of nurses by Christmas. That's not guaranteed. That's absolutely guaranteed. In every hospital, in every city, every county, every state in the United States of America, there'll be shortage of nurses. No, that's a guarantee. By Christmas, probably by November. And then you're going to have nurses dying off from COVID, right? So it's going to make the shortage more desperate. And then you're going to have nurses getting infected with COVID. So they may not die per se, but they might be in an ICU room, or they may be, suffering and recuperating at a med surg room, or maybe recuperating at home. But you're going to have another 50 to 100 nurses with infected with COVID-19 in hospital or at home, who can't be in a hospital in the ICU room, as a patient. So, so you're not going to have these nurses working because they can't work because they have COVID-19. So you're looking at by Christmas anywhere from 100 to 200 nurses in every hospital not there, not working at the hospital because of COVID-19. That's what we're looking at right now. Um, so yeah, I mean, it's serious stuff. This is not like a common cold or your normal every season flu. It's not. It's a global pandemic that kills. Uh, yes, the flu kills, but I mean, it doesn't. I mean, it's nothing compared to COVID-19. I mean, COVID-19 like has problem with blood clotting. It could give you a stroke. It could paralyze your body. I mean, geez, flu doesn't do that. You know what I'm saying? I mean, geez, so yeah, so every hospital is looking at an emergency situation starting like probably November, because I'm predicting that all the area hospital will be packed in November. Because remember, nobody has banned Halloween, which means people are going to have fun in Halloween because that's what people like to do. You know, people are kind of like children. If you let them have fun, they will have fun. You know what I mean? So if you don't illegalize Halloween, everybody's gonna have fun in Halloween. Nobody's not, you don't want to be the chump not having fun in Halloween, right? So Arlington County, Alexandria City, Falls Church, and Fairfax County is not banning Halloween. So everybody in these areas are going to be having fun. College students will be having fun with college students. Families will be having fun with families. You know how people are. You know, I mean, you've been to high school. Like, what are you going to do? Not have fun with other people when they invite you? You know what they're going to say about you behind your back. You know what I'm saying? So that's why it's like a social network, right? So if the governments do not ban Halloween, then with the social networks operating, you can't like refuse to go to a Halloween event, right? When your friends are throwing it. And because if you don't go, they're gonna talk about you. They don't care if there's a pandemic. You could be like a social outcast. So there's like a negative peer pressure operating, right? Because you may be a nurse, but your husband may not be a nurse. And most people they don't really treat things seriously like nurses do because nurses know, they know how bad things can get. So normal people they'll be like, hey, if you're gonna get it, you're gonna get it. That's the attitude everybody's gonna have. When I say everybody, that's like over 80% of the people in Arlington, Alexandria, Falls Church, and Fairfax County will be like, you're gonna get it, you're gonna get it. I'll wear a mask, but I'll go to the party. That's like 80% of the population. I'm a historian, so I understand human nature, right? Because that's all I study as a historian, research human nature, what human nature causes people to do, causes people not to do. What are the limits of acceptability? How does human nature fit in? Or where does ambition fit in? All these things. How the social units operate, how do traditions, customs, laws. So we see the interrelationship between people, culture, practices, laws. So these are what we examine as historians. And how history changes because of that. So my expertise as a historian sheds light on the global pandemic that, like Dr. Fauci, someone who's not an expert historian, cannot see, right? Dr. Redfield, who's not a professional historian, cannot see what's happening at the macro level in America. All right, I can see because I'm a historian, and that's all I study. Right, as a historian, how micro levels impact macro levels. Um, in light of culture, law, history, traditions. And so I'm an expert historian, and so you need expert historians during global pandemic to understand what's going on because you cannot observe everybody, 330 million Americans, 24/7. That's just impossible. We don't have the technology to do that, and so but 330 million people are making decisions every second, right? They're moving around making decisions every second right now. Like even as you watch this show, 330 million people are doing something, making some decisions in their workplace, in their family, in their personal life. And you can't monitor them. Only God can see everything. That's why we say God is omniscient. God sees everything. God is omnipresent. God is present everywhere. Um, you know, um, so God is present everywhere, and that's probably why He knows everything, right? But you can't be present everywhere. U.S. government cannot be present everywhere. Healthcare experts cannot be present everywhere, so they don't really know what's going on. So you can say every assessment is like way behind the actual act, right? At a society level, right? So whatever is happening right now, you're not going to really know until like days, weeks, months later. Yeah, and that's why pandemics often kill millions of people without any problem because government assessment of what's going on in their own society, their cities, towns, it lags behind weeks, sometimes days, sometimes hours, sometimes months. And by the time they get an accurate picture, it's too late. And that's why safest thing to do is to shut down completely. Because even if you shut down your nation completely, like Israel did, there will be people violating your curfew or your laws, right? Like during the height of prohibition, people still drank. There were places that were selling alcohol. It's the same thing. If you shut the whole country down, there will still be people going to those underground drinking areas and drinking with a lot of people without their mask on. It's going to be a thriving illegal business everywhere there's a complete shutdown. Why do you think they have cases? In order, you cannot have cases unless people are infecting people. Do you see what I'm saying? They're getting infected somewhere, right? Uh, they have to be infected by people. Although they say COVID-19 will get by touching surfaces where COVID-19 is, and then kind of rubbing your eyes with it or whatever. Um, but yeah, so but you see what I'm saying. So things are really really bad, and yeah. So what's happening is um, things are things are getting worse and worse, and governments don't know what the heck is going on. Um, yeah, but my recommendation for governments is to shut down completely. Because even if you shut down completely, there will be lawbreakers. In any circumstance, you're gonna have lawbreakers. People who are going to exploit the situation to sell things illegally if things are not sold. Um, if gatherings are illegal, they're going to create an underground venue where people could enter illegally to socialize. Uh, I mean, it's just you have to expect that. So even if you shut down completely, there will be people getting infected with COVID. People, mostly people who break the laws of shutdown laws. Because if you're inside observing the laws, you won't get infected, right? It's those people who break the law and venture out who get infected. Yeah, so this is COVID-19 global pandemic. The best thing to do is shut down everything. Well, Italy is opting not to shut down completely because their economy is doing badly. But do you want to live or do you want to die? I mean, if you want to risk dying, I mean that's your prerogative. But more people are going to die if you keep things open to protect the economy, right? So whereas you might have only had 3 million deaths, if you keep things open because of economy, you're going to have 30 million deaths. You see what I'm saying? That's why I'm estimating death from 3 million to 30 million. Because if you keep things open for the sake of economy, more people are going to die. That's just unavoidable. Um, yeah, so you have to balance the two, right? Um, but people who are working, meeting people, they have risk of getting COVID and dying. That's just, that's a simple math, right? Simple science, and people can understand that. Um, the Italian Premier Giuseppe Conte opted against another heavy nationwide lockdown, which I think is a mistake. I think Italy will have millions of COVID-19 deaths because of this one decision not to lock down. The new decree goes into effect Monday, that's today, and lasts until November 24th. I mean, geez, November 24th, we still have like 5+ months of flu season left, and November 24th. What is this guy thinking? You know what I'm saying? I mean, we're just getting started with COVID-19 death. We have six to 8 more months to go. Second article, COVID Spain imposes national nighttime curfew to curb infections, and that's in BBC by staff. And the significant quote from that is Spain has declared a national state of emergency and imposed a nighttime curfew in an effort to help control a new spike in COVID-19 infections. Prime Minister Pedro Sanchez said that curfew, which came into force on Sunday night, that's yesterday, would be in place between the hours of 11 o'clock and 11 p.m. and 6 a.m. Under the measure, local authorities also can ban travel between regions, like from DC to Maryland, Maryland to Virginia, you know. Mr. Sanchez said he would ask Parliament to extend the new rule initially enforced for 15 days. So he's practicing his executive power, but he needs the legislative branch, which is the Parliament in US, it's the Congress or Senate, to extend it to 6 months, right? You need the legislative branch to confirm more permanent. So he's smart to understand that for the next 6 months, people are going to die. But his mistake is the curfew is not going to, it's going to reduce the death for sure. But you can still expect millions to die if you don't go to a complete lockdown. Just simple as that. Obviously, these European leaders are willing to have millions of deaths to protect their economy. You gotta make the decision, right? Either you live or you risk your life for economy. Like during the westward expansion in America, a lot of people died because they wanted to make wealth in the West. And some went because they had nothing left in the East. They didn't have a job, and they didn't have any source of income. So they needed to go somewhere they could get income. Only place they could go was the dangerous West Coast, in the westward expansion. And many of them died. They died by Indians, arrows, or some of them were scalped. Some of them died because they didn't have food. Some of them were eaten by, wildlife like, lions or, tigers or whatever is in the region. And, some people got bitten by a snake, So they took the risk and many died. You see what I mean? Whenever you take the risk, you're going to have many deaths, We don't know, we don't talk about how many people do die, but a lot of people died, taking that risk. If you take the risk, there's going to be much greater number of deaths. And so it seems like Italy and Spain are shutting the country down during like evening and night and morning, hours. But that's not going to reduce the death significantly. It's going to reduce the death, obviously, but not by much. So both Italy and Spain can expect millions of deaths. And I think they know, that they need to go to lockdown. They just they're just preventing the inevitable, I mean, you're going to have millions of citizens die from this. They know this because they didn't expect the spikes to happen. Obviously, it took them by surprise. Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District, the Leonardo da Vinci of 21st century, said it will happen. I told you so. I'm right. You're wrong. I'm right. Spain was hit hard during the first wave of pandemic earlier this year, and at that time imposed a much more restrictive lockdown, one of the toughest in the world. But Spain was like number one or number two for COVID-19 death, even though they went to lockdown. So even if you go to lockdown, people are going to die in large numbers, but you may have hundreds of thousands die with a complete lockdown from now to June. But without a lockdown, you're definitely going to have millions die Spain, millions die Italy. Yeah, that's just what you're looking at. But that you're taking the risks. France, the third article says France hits record 52,010 daily COVID-19 cases. Spain declares a new state of emergency. This is by staff NBC News. So a 10% death rate, which France had in April. It was above 10%. It was like 12, 13%. So at the 10% death rate, France is looking at 5,200 deaths several weeks from now, just from one day's infections. Yeah, millions are going to die in France. That's like guaranteed, absolutely guaranteed. Especially in cities like Paris, Marseille. You're going to have like, you could have up to like 50% of the city die. You know that, right? I mean, this is a global pandemic. If it gets really bad, I mean, you could lose 10% of everybody in the city to death, COVID-19 death. You could lose 20% of your whole city to death. Yeah, I mean, these things are all possible, This is a COVID-19 death. I mean, it's a global pandemic. There are hundreds of years of research on global pandemics and how many millions they kill. So it's not like new science, we're talking about science that's existed for hundreds of years. Pandemics don't come around often. So people forget the last pandemic that killed a lot of people was Spanish flu pandemic of 1918, over 100 years ago. So that's why people, forget and they think it's not serious, but it is, right? But people forget. Historians write history, but people don't always read the history, right? And that's why history repeats itself. Yeah, so the significant quote from that is France registered the record 52,010 new confirmed coronavirus infections over the past 24 hours. And Spain declared a new state of emergency to try and curb spiking COVID-19 numbers as Europe is gripped by a second wave of pandemic. They didn't think it was going to come. Hey, I told you so. I told you so. I told you so. Yeah, I told you it would be coming. Why didn't you believe me? It's like, I tell every hospital, their hospital is to be packed with COVID-19 patients in November. They don't believe me. Just wait until November. By Thanksgiving time, all the hospitals will be packed, overflowing in this area with COVID-19 patients, And you'll be like, oh, I wish somebody told us about this. I did. I'm telling you now. Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. I'm telling you now that by November, every single hospital in this area will be packed with COVID-19 patients, and you're going to have multiple deaths every day. Yeah, I told you so. That's what I'll be saying like a month from now. You'll be like, oh, why would somebody told us? Well, you should see this show. You should tell everybody to see this show because I did tell you. I told Europe they're going to have a spike. They're going to have millions of deaths. I told you like months ago. I mean, you got to get with the program. I'm the Leonardo da Vinci of 21st century. If you don't see my show and benefit from my analysis, don't be complaining that things are happening. I told you months ago that this would be happening. Yeah. I mean, you think I'm just guessing? No, I'm doing an analysis based on my various fields of expertise. Yeah. So this is an expert analysis. It's not just a guessing game. Yeah. Anyway, yeah, facts and figures don't lie. And I've been trained as a professional historian to historically analyze events, people, facts, data at UCLA. And I'm an expert clinical nurse leader. I'm certified nationally to be clinical nurse leader. So I'm an expert, certified expert by de jure and de facto. Yeah. And I have so many fields of expertise, it's not even funny. I'm an expert teacher of science, English, math, history, certified in Virginia and DC and Tennessee, South Carolina, Alabama, Georgia. I mean, geez, I'm a certified expert. And I give you expert analysis. I'm not just guessing here. This is an expert analysis show based on expertise. Yeah. So don't be surprised if every single hospital is packed in Innova Fairfax Hospital, Virginia Hospital Center, Innova Alexandria Hospital, Children's National Hospital, George Washington Hospital, Mesner Georgetown Hospital, Georgetown University Hospital, Mesner Washington Hospital Center, Sibley Hospital, Suburban Hospital. You're all headed to massive COVID-19 death. And you're going to start seeing it in November. And your hospital will be packed with COVID-19 patients in November. Why are you surprised? Look at the numbers. Numbers don't lie. More cases equals more death. More cases, more death. More cases, more death. More cases, more death. More cases, more death. Get that straight through your mind. This is a simple math. If you have more cases, you're going to have more deaths. Yeah, I mean, 2 plus 2 is 4 people. Do you remember first grade? Yeah. So continuing on with the article, so we can start from the beginning. Just to remind you how important this thing is, France registered a record 52,010 new confirmed coronavirus infections over the past 24 hours. And Spain declared a new state of emergency to try and curb spiking COVID-19 numbers as Europe is gripped by a second wave of pandemic. France's grim new milestone follows a record 45,422 on Saturday. That's one day. So on Saturday, out of them, at 10% death rate, you're going to have 4,542 die for sure, minimum. Because death rate in France is higher than that for winter. The health ministry said in a statement on Sunday, yeah, you're going to be having tens of thousands people die just in Europe. Just in France, you're going to have like over 5,000 die per day. That's coming in a few weeks, like in November. And then you have 6 more months of flu season where death will continue to increase. So if you have 5,000 people dying in November, you could easily have 10,000 people dying in December. Yeah, it'll be too late by that time. Everybody's like, you have all these infections. I mean, you should be shutting down now, France, I mean, geez, it's not working. Your curfew is not working. You need to shut the whole country down. I mean, as it is, even if you shut the whole country down, you may have over a million deaths now at your current rate of infection. But if you don't shut your country down, you may have millions of deaths. I mean, by June 2021, we may not have some European nations exist as a nation. So many people would have died. I mean, you should be surprised by millions of deaths by June if you don't shut down. This is a global pandemic. We all know what global pandemics are. You cannot beat this thing. So you idiots who are talking about beating COVID-19, stop your idiocy. You cannot beat COVID-19. You cannot beat it. So all you idiots talking about beating COVID-19, stop it. You guys are being idiots and you're just, proliferating idiocy in the world. So stop talking about beating COVID-19 because you cannot beat COVID-19. It's a global pandemic. No one in the history of humanity has ever beat a global pandemic. So why do you think you are? You're like so full of it. You think you beat a global pandemic? Well, who made you God? Who died and made you God? You're so full of it. Oh, we're going to beat COVID-19 because we're like gods. Blah, 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 blah. Yeah, stop talking about you being a god beating COVID-19 because you're not a god. You cannot beat COVID-19. Only thing you can do is survive COVID-19. And only way you're going to survive COVID-19 is not meeting any other human being, right? If you don't have to, do not meet another human being in person. That's the only way you're going to survive this thing. Yeah. Anyway, I'm just trying to help you guys, because there's so many idiots on the screen. They think like they're in a boxing match with an invisible virus. It's like somebody saying, I'm going to wrestle Holy Spirit. Good luck with that. You cannot see the Holy Spirit. You know what I mean? Yeah. What can you do? You have to be smart to survive COVID-19. You know what I mean? Yeah, I mean, don't follow the people into jumping off of a Brooklyn Bridge. You know what I mean? Yeah. Or don't go down with the Titanic, a ship that God could not sink. Yeah, I mean, you dare God, you know what God's going to do. You know what I'm saying? Anyway, yeah, I hope your family will be well and your children will be well. I hope that you will listen to my advice, and survive this COVID-19. We're looking at 3 million to 30 million deaths by next June in the United States alone. That's, it's practically guaranteed. It's practically guaranteed because the numbers are spiking. And we know, more numbers mean more deaths. That's just unavoidable. It's simple math. This is a global pandemic. And obviously, the death rate is not going to remain at 3%. It's going to go up to like 5%, maybe 10%, 15%, 20% if you run out of nurses and hospitals beds. You could go up to 30% of everyone who has COVID can die in the flu season, 6 months long. That's why nurses are important. Yeah, you run out of nurses, your death rate's going to spike in your city. Um, yeah. Yeah. Anyway, I hope that you think about everything that was said in this show, and tell everybody to watch this show every day, because things are getting bad, and we're just beginning to enter 6 months of flu season. So everything you've seen till now is nothing really, because April was like end of flu season. Now you're gonna actually see COVID-19 at work during flu season, like the height of flu season. And you're going to see how crazily powerful COVID-19 is. As you start bearing your child to COVID-19 death, your husband to COVID-19 death, you will realize and experience personally how powerful COVID-19 is in the flu season. It's sad that you have to learn from experience rather than, prevention is always better. It's better to prevent you getting COVID-19, your children COVID-19, getting COVID-19 so they don't die. But prevention doesn't work because people can't see what can happen to them and their loved ones. And that's what we're seeing here in Arlington County, Alexandria City, Falls Church City, and Fairfax County. People can't see their child dying from COVID-19. So they're acting like their child is not going to die, but your child will die if you're irresponsible and have active socialization. But you maybe you have to learn the hard way. That's the unfortunate thing. Because Heerak Christian Kim, independent candidate for U.S. Congress, created this show to try to save your children from COVID-19 death before it happens. But, if you ignore it and you think it's not serious, maybe you end up learning the hard way. And that's unfortunate. That's what I'm saying. I think that's very unfortunate. Yeah, but I hope, you will listen and you will share with others and have others watch this show so they too can save their children from COVID-19 death. Because that's coming. I'm predicting thousands of children will die in Arlington County from COVID-19 in the next 6 months. Because like I said, a lot of parents are not being serious about protecting their children from COVID-19 death. Because they don't believe that it will kill their children. And it's sad because it will. It will. We have documented cases of children dying from COVID. So we know that happens. So if you're irresponsible, you may end up burying your dead child, or maybe all of your children will die from COVID. So you may bury all 3 children, and that's a sad thing. It's better to be careful, side of caution, you know what I'm saying? I mean, you only have what, 1 child, 2 child, 3 children. If they die, I mean, how will your life look for the next 50 years, even if you survive COVID? You know what I'm saying? Yeah. Anyway, I hope that you'll be well and your children will be well. And I look forward to seeing you tomorrow. Bye.